Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is April 14th. This week is Black Maternal Health Week. In Wisconsin, infant deaths are 3 times higher for Black babies than for white, and state health professionals are working hard to combat negative outcomes for Black mothers. So joining us to talk about her work in this field is Dr. Jasmine Zapata. She is a physician, an assistant professor, and a researcher with the UW School of Medicine and Public Health. And Dr. Zapata, thank you so much for making the time today. Help us understand the scope and the importance of this issue.
This issue is so important because Wisconsin leads the nation in Black maternal mortalities and Black infant mortality. And so that is a significant public health crisis that we cannot ignore. And I'm so excited that this week is bringing awareness to that.
And you yourself had a preterm pregnancy. Did that experience drive you to be a leader in this field?
It definitely did. When I was just almost 6 months pregnant, 25 weeks into my pregnancy, I suddenly started having a sharp pain in my lower abdomen as I was actually walking to class. I was in medical school, actually. And when I got to school, I just kind of thought that maybe it was just gas and it would pass, but it kept coming. That sharp pain kept coming. I called the doctor's office and talked to the team, and they said, "Oh, you're just having false labor, just lay down." And for almost 3 hours, I called over and over again, and it was kind of dismissed. But then there was a change, and I knew that this was an emergency. And within 2 hours, I had my little baby girl. She was born only 1.5 pounds, critically ill. And thank God she survived after multiple life-saving surgeries and interventions, but she survived. And 3 months later, we got to leave the ICU, and I brought her home. But as I was going through that experience, I said, "God, I know we're not supposed to make promises or things like that or bargain, but please save my baby girl. And if you save her, I will do all that I can to continue to bring awareness to this issue." And that was just the beginning. And I've definitely dedicated my whole career to that. And I'm very passionate about this cause.
Such an incredible experience. And some people may assume that the mother's income or access to health care makes a difference, but research shows that's not necessarily true, and your experience shows that's not necessarily true.
Correct. College-educated Black women have almost twice as high of a chance of having an adverse birth outcome or complications in their pregnancy compared to white women who are high school dropouts. And so it doesn't matter, even with social economic status or education, we still are seeing these inequities.
And what is driving that? Is there something else at play that is leading to this?
Great question. There are studies that show that first-generation women who moved to the United States, first-generation women who moved to the United States from Africa, their birth outcomes are similar to white women. But the longer that their generations are here in the United States, then that's when we start to see a widening of that gap and start to see these an increase in these horrible birth outcomes. And so it's letting us know it's not just genetic, like something in our DNA, but it is based on lived experience, the experience of being a Black woman in America over time. So it's very complex, very multifactorial. There are a lot of different things playing a role in this, but it's so important that we continue to bring awareness to this issue, like interviews like these. So thank you so much.
And you do a lot of research in this field. What sort of solutions has your research led you to become an advocate for this really complex issue?
Yes, incredible question. The research that I do focuses on listening to Black women. It's pretty simple. I can just summarize it like that. Listening to the voices of Black women, telling about their lived experiences, even from childhood, and how different things in their life have impacted them. Also, their experiences with interacting with healthcare and public health systems, particularly as they're going through the birthing process, prenatally, during pregnancy, and after. So over the last few years, I've been doing series of one-on-one interviews with Black moms during pregnancy, immediately postpartum, and then around 6 months after they have a baby, to just follow their experience and ask them a few key questions like, what are things that we can do to improve trust with the healthcare system and repair harm? What has been your experience with doulas? What are things that you need from the community to help you feel supported and uplifted and loved? And I have just been having some incredible conversations and getting some incredible insight that is so rich and valuable. And my goal as a researcher is to take that very important knowledge and disseminate it as widely as possible.
Research published in 2020 has found that when Black newborns are cared for by Black doctors, they're more likely to survive. Do you agree with this finding? And what can that tell us?
Yes, that was very, very interesting paper. And I was so excited when that came out. What it is giving us insight to is the concept of implicit bias, where sometimes we don't even know that we're making judgments or we're making certain decisions subconsciously that are different based on a patient's race. There have been studies that have shown that, for example, in our own healthcare systems, that Black patients receive less pain medication compared to white patients for the same complaints of pain. And it's no one that's like actually obviously trying to be racist or outright treat people differently. It's all like in our subconscious. And there are also some systemic structures in place that contribute to some of these outcomes that we see. So it's very interesting. That finding about Black doctors when they treat Black babies, there are higher survival rates. I think that's just giving us a little glimpse into how others can have implicit bias. So it's very interesting. There's a lot more research that needs to be done in that area, but I was glad that at least shed a little bit of light on that.
Now, you said part of your work is simply listening to Black mothers. At what point does the data just not hold up to the experience and stories of Black mothers that they have been telling for a long time?
That's really what I get excited and passionate about, just spreading the word about how important and how much weight Black mothers' experience carries. A lot of times just coming up in academic fields of medicine and research, we put a lot of weight on, to be honest and quite frank, people who have gone to Ivy League universities or how many degrees and titles they have behind their name, how many publications and accolades they have. We tend to look at that and elevate that level of evidence. But when it's somebody who just shares a story or a lived experience, in general, we don't look at that as highly. What I am trying to say is we need to take the voices of the people who are most impacted by this problem and take that very seriously and elevate that above any fancy paper or publication. We need to listen to Black women. It's that simple. So that's what what my mission and goal is.
Wisconsin has held this moniker, as you said, as the worst in the country for rates of disparities in infant mortality. And the State Department of Health reported that it's getting worse. What additional research, resources, outreach is essential to help move the needle?
Great question. In order to move the needle, we really need to be looking at this from a social determinants of health standpoint. We can't wait until a Black woman is pregnant to start intervening and giving her support. We need to be looking at a life course perspective from the moment a young Black baby girl is born. We need to be supporting her. We need to be making sure that her experiences going to school or just trying to live a life, not just to survive, but to thrive. We need to make sure that we're supporting her in all areas of her life. We need to combat the racial wealth gap that Wisconsin is pretty bad with that. We need to combat the educational disparities we see among races. We need to get equality with housing. We need to reform our criminal justice system, where a Black man who does a crime is sentenced at higher rates than a white man who does that same crime. So we need to reform our criminal justice system, reform our housing system, combat systemic and interpersonal racism. There's a lot that we need to do over the life course, because we know that adverse childhood experiences, things that are experienced kids, even 18 and younger, that impacts their long-term health outcomes. And I would argue, and many say, that racism is an adverse childhood experience. Think about all the kids right now that are having to watch the news and watching the trial right now, the murder trial of Derek Chauvin. For example, all these young kids watching things on the news or experiencing what's going on in our world today. As it relates to racism, that's an adverse childhood experience right there. And all of that stress and chronic inflammation, that can cause long-term health outcomes. So I guess to answer your question in a short period, because I could talk about this all day, is that we need to look at this from a social determinants of health standpoint, and also over the entire life course, and looking at how we can support the entire family unit and community unit.
You just described a whole host of systemic issues. Does this take a broader acknowledgement from a larger group of people to acknowledge that racism is at play? Or does it just take a minority of voices that are activating on this issue in order to institute change?
Both of those. We need leaders and advocates and people to be outspoken about this, but we can't do it alone. We need every system working together, everyone working together to combat this. And a lot of people think of this just as like a health issue or a public health issue. We need to be having landlord associations working with us. We need to have leaders of educational institutions joining with us. We need politicians on board. We need everybody, all hands on deck, because it all plays a role into this. This is more than just a healthcare issue in the healthcare sector.
All right, we need to leave it there. Dr. Jasmine Zapata, thank you so much for talking with us about this today.
Thank you so much.
For more from Here and Now, and to dig into this issue more, you can check out an interview with Angela Fitzgerald on the digital series Why Race Matters, and you can see more about Black maternal health at pbswisconsin.org. And thank you so much for joining us on Noon Wednesday.